Right. So if you have read and understood, considering
Yes,
it
ma'am.
critical care scenario, kindly tell me what are the feeding, what are the nutritional options available for this patient?
Yeah, this patient nutrition, our option is like parental nutrition, like TPN and PPN,
And
because the patient is anastomosis case,
okay,
and patient is defunctional ileostomy. So I
yes,
consider as a parental nutrition, TPN
parental
and
nutrition.
PPN.
Okay, what is the difference in TPN and PPN?
PPN is in central central line. PPN is used in peripherally.
Yes. I'm
Peripheral
sorry, I meant to ask
vessel.
you if there is any difference in constituents which you will be giving to them, or which you will be giving to this
Okay.
particular patient.
In TPN we give the high osmolarity
Yes,
content,
yes,
but in PPN we give not give because it peripheral vessel are smaller
can
in
irritate. Yes,
smaller in narrowing. Yeah.
they're
So
small in
there
size. Yes,
there may be small in size, and it is constricted. So and high osmolar, if we give in peripherally high osmolar, there may be chance of thromboembolism or Gluteus.
okay,
But in
good,
TPN we can give it high osmolar food.
good. Can you tell me, please, if you have to give TPN to this patient, what are the routes available for administration?
Madam, route of administration is a central line, and we give it in
What is PIC
severe
line?
malnutrition patient.
Can you please tell me what is PIC
Sorry,
line?
ma'am.
PIC line catheter. How is
No,
it
ma'am.
inserted according to the NICE guidelines? And where is it inserted?
No, ma'am. Sorry, I'll
Okay, next time.
later.
You'll
I
say
will
I'll
answer
come
it
to
later.
this question later. Okay, can you please tell me what are the
Yes, sir.
constituents of total parental nutrition, TPN?
Constitution is carbohydrate,
Yes,
lipid,
yes,
and some
water,
minerals, vitamins,
yes, and water as well.
and
What are the
yes, and
yes vitamins that are available or present?
electrolyte, ma'am.
Vitamins.
Sodium chloride, potassium chloride,
Which vitamins are
amounts,
present?
ma'am, and carbohydrate.
No, I'm sorry, vitamins. Which
Vitamin.
vitamins are present in TPN? A,
We
D, E.
give thiamine, soluble vitamin.
Okay, all right, okay.
Like
Can you please tell me what would be the main source of carbohydrates in TPN?
carbohydrate
Glucose.
means glucose. Yes,
Glucose, yes. Okay. Other than this patient, generally, can you give me few indications for giving TPN to the patients?
Okay, ma'am. If we give TPN in severe burn patient, severe
Yes,
sepsis with multi-organ failure,
yes,
malnutrition, severe
yes.
malnutrition patient, and severe trauma patient, we
Okay,
can give
and
TPN.
what about for gut problem patients, like with short gut? Okay,
Yes,
good.
if a short gut syndrome patient, we also give a TPN. If we
Okay, can you comment on what is enteral nutrition?
international, like oral nutrition, naso, duodenal, naso, jejunal nutrition, and percutaneous pig,
Yes.
percutaneous pig, and jejunostomy.
Okay, once you are giving nutrition to this patient, this particular patient, how would you assess nutritional status of this patient?
I will assess the nutritional status of the patient in central line TPN. we assay weight initially and every month and BMI initially and every month. If it is not possible to measure, then we'll see the triceps and yeah, arm
Okay. Yes.
arm measurement,
What
and
does this
we
called?
we
Anthropometric
monitor the.
measurements. Yes. Yes. And you'll
Yes,
measure what
then we
else?
also measurement the electrolyte in first every weekly until stable, then every 2 weekly, and we also measure the liver function test, and
Very good. Okay.
we also
Yes.
measure
Albumin level
serum creatine,
and albumin
the
levels.
albumin
Okay,
measure,
good.
also bone density. Yes, ma'am.
Yes, very good. Thank you. Can you please tell me if a patient happens to not be having enough nutrition, what are the signs of malnutrition that you'll pick as a physician or as a surgeon?
Madam,
Patient is
we see
post-op.
the
So this is the hint I'm giving you. In post-op patient, if inadequate nutrition is being given to the patient, what would be the signs of malnutrition? Poor healing of the wound.
initially
One,
electrolyte
yes,
hypomagnesemia,
albuminemia,
phosphatemia,
yes,
hypokalemia,
very good. And
hypoalbuminemia.
decreased cough reflex
Uh,
leading to pneumonia, etc. Okay. Can you please tell me what is the daily nitrogen requirement for an adult?
0.9 micro gram
0.15
per
gram per kg
this,
for
this.
healthy person. But what about for this post-op critical patient? How much does it increase or does it decrease?
Should be increased, ma'am.
It should be increased. Very good. It's 0.3 gram per kg. Good. Can you
Yes.
please tell me what are the advantages of giving enteral nutrition over TPN? Any advantages you can tell?
It on TPN, madam. Sorry, I
Yes,
missed the
enteral.
question.
Yes, you can tell
Sorry.
me the advantages of
Madam,
giving
please repeat
enteral
the question.
nutrition over TPN. Enteral nutrition is safe, cheap, fewer complication, prevents
Okay.
from atrophy of gut mucosa, and what else?
Madam, it also
Okay. Can you please tell me how would you calculate?
help
Yes.
to prevent the calculate, ma'am.
Yes,
Sorry,
if you can tell me
don't understand
how
the
would you
question.
calculate the nutritional requirement for a patient who is post-surgical, like this patient? So what things you'll keep in your
Okay,
mind? Yes.
I will start slowly first. 10 kilocalorie per kg per day, and I will complete within full requirement in 3 to 4 days to prevent the refeeding syndrome.
Okay,
And I
good.
also add some
This
vitamin
is,
like thiamine,
yes, all
and
right.
I also
I wanted you to tell
electrolyte
me,
like potassium.
yes,
Sorry.
from giving the normal value, how would you increase the value? Like it will be 35 kilocalories per kg, and you will increase it by further 10% by degree increase in temperature, like this is post-op patient. And you mentioned refeeding syndrome. Can you please tell me what is refeeding syndrome and how is
Refeeding
it
says
caused?
the feeding system is a metabolic disorder of a feeding person after take feed after long time starvation, which is associated with hypophosphatemia, hypocalcemia, hypomagnesemia, and hypokalemia.
Okay, good. Thank you. Can you please help me and read what this red arrow is pointing at?
This is the left side X-ray of the AP view. Show
Yes.
the left side of the gut obstruction. It may
Okay.
be occurs due to Crohn's disease.
Yes, Crohn's disease, but this particular pattern signifies something. It is
Yes,
called
it is a coin-like
Yes,
coin-like pattern. It's not a bowel dilation,
very good.
coil-like pattern.
Here is your question. So if you have read and understood, considering its surgical anatomy station, kindly tell me if you identify the region, please.
Yeah, it is the gluteal region.
Okay.
Uh,
Why
and-
does
and,
it yes, why does it have superficial and deep written on it? What does that signify?
in the superficial, there is showing the gluteus maximus and medius muscle, but in the deep, the two muscle are retracted, so it is called the deep.
So the muscles of gluteal region are organized in layers in deep and superficial manner, right? So what are the
Yes, ma'am.
muscles which will be categorized as superficial? If we come over here, can you please identify this muscle?
Gluteus medius
Very
muscle.
good. Very good. Okay, and this one below that?
Gluteus maximus.
Very good. Okay. Can you please tell me the origin and insertion of gluteus maximus muscle?
Gluteus maximus muscle originated from outer posterior and outer side of the ilium and sacrum and sacrotuberous ligament, and inserted in the gluteal tuberosity of femur and tensor and in the iliotibial tract.
Okay. What is the nerve supply of gluteus maximus muscle?
Inferior gluteal nerve.
Okay, good. Can you please identify this muscle on the deep side? Yes, here. My arrow is the lowermost muscle. Can you please identify it? And kindly tell me the origin and insertion of this muscle.
Sorry, ma'am.
It's called quadratus femur. Can you please tell me the origin and insertion? Do you remember?
Sorry,
What is
ma'am.
the nerve supply of quadratus femoris muscle? Nerve to quadratus femoris.
Nerve to quadratus femoris.
Which is a branch of? Can you tell me the action of quadratus femoris muscle? It's the lateral rotator of the thigh. Yes. Okay. Which other muscle can you? All right. This is another very important muscle. Can you identify this one, please?
It is gluteus minimus muscle.
Very good. Okay. And this muscle also plays some special role. What is this muscle called?
Obturator externus.
Piriformis.
Piriformis.
Yes. What is the role of piriformis muscle? What does it do? It divides.
It divides the in the gutter sciatic knots in the
Yes,
upper and lower
upper,
portion.
lower, and upper and lower. Okay,
Mm.
what passes through this one? Is it upper notch or the lower notch?
Lower notch. Lower
Okay, what are the
lower notch.
contents which passes through this notch, please?
Infragluteal vessels and nerve, internal pudendal vessels and nerve, sciatic nerve, and nerve to obturator internus, nerve to quadratus femoris, and posterior cutaneous nerve of the thigh.
Okay, good. Can you please identify what is this tree, please?
This is the head of right left femur.
Okay, to the left. Okay. What is this one? 2.
Greater trochanter of femur.
What is this 4? Please.
This is neck of
What attaches here? Can you please tell me? Yes.
sorry, I forgot.
Okay, we'll move on. Doesn't matter. Can you please tell me what 9 is?
This is
Shaft
the
of femur.
surgical neck of femur.
Shaft of femur. Okay. Yes.
Shaft of
Here,
okay.
if you can identify 11 over here, please.
This is the group behind the greater trochanter of femur.
You know you're getting that wrong. Okay, can you please tell me the blood supply of the head of the femur in adult?
Madam, there is two anastomosis. One is cruciate and is trochanteric anastomosis, and the blood vessel supply it is lateral circumflex femoral artery and medial circumflex
Yes.
femoral artery,
Which are branches of?
and branch of profunda femoris artery,
Very good. Okay. Then
and
there
there is
anastomosing with
and superior gluteal artery and inferior gluteal artery.
okay.
And another is
Acetabular branch of which nerve? Which vessel?
and vessel ligamentum vessel to a perforating branch of first perforating branch of profunda femoris.
Okay. Artery of ligament of head of femoral head. Okay. All right. What is peculiar or typical about the blood supply of the head of femur? Can you please explain? Why is it important? And in which conditions?
In case of fracture neck of femur,
Yes.
there is maybe a vascular necrosis
Yes.
of the head and
Yes.
disruption.
That's
blood
why as a
supply
surgeon, it's important for
to
you
the head.
because yes, mostly elderlies come.
So,
Okay, these markings,
Yes.
you'll get the recording and I'll ask you tomorrow again. You should be knowing them. See, these are the red ones and these are the important ones they are mostly asked in exam. Can you please tell me how the hip joint is formed?
hip joint is formed by the head of the femur with the
Yes.
acetabular cavity of the pelvis.
Okay.
Joint to the acetabular
How the
cavity.
acetabular cavity is formed? With the help of?
With the help of three bone
Yes.
contributing ilium, ischium, and pubis.
Yes. Okay.
And
Okay. Yes, that was it. Thank you. Right. So if you have read and understood, considering this communication skills patient, kindly begin.
Hello, I'm Dr. Muhammad, one of the surgical doctor. I'm working at Downtown Hospital. I'm working with this man. I'm calling for an advice about an patient who had underwent mastectomy with axillary crina. I am calling
Yes, yes,
to speak to Mr. So, yeah, how far am I speaking to, please?
yes. You summarize the case, please.
Good. Okay.
Okay. I have an fragile elderly lady who has underwent mastectomy with axillary crina. Now she is the day post-operative day, second day. Also, she has a history of COPD with mild ventricular failure. Okay? The thing is, her daughter is trying to convince her that she has to go home. That's why I'm calling you.
Okay, this is the patient decision, or anyone built her to make this decision to go home?
I think the daughter is trying to convince her, although the patient is, I think she is want to go home, her home, when she is well enough.
This patient is allowed to make the decision.
Yes, the patient is competent for informed consent.
Okay. If we discharge the patient, what do you think that happening in the patient?
Okay, I think this patient there will be reaction hemorrhage, and also I think also she's very much under stress, so there will be exacerbation of the COPD, or it might be due to CVT because there is following. Also, there might she might suffer from PE.
Okay. What is the plan of action after if any issue of complication develop?
Good.
Okay, firstly I will check for full blood count for the bleeding. If there is coming of the hemoglobin, then I will ask also for the blood count for the axillary GPT. Also, I will ask for CTBA in any suspicion of DE.
Okay. Do you take any legal signature from them, or any plan of take signature?
I will, okay, I will ask her to fill a legally consent. She wants to leave or try to leave.
But
Okay.
it's
Do you
okay.
want to inform her?
Okay, continue, please.
Yes. Do you want to inform her GP for his condition?
Yes, I will involve her GB for visit home, and also I will write him the current situation and the current case and her past medical.
Is it safe to discharge this patient now?
No, the patient is not well enough as is right now. There is fresh blood in the drain, so there might be fear of reaction hemorrhage, and also there is a fear of development of hematoma, and also I might expect CVT or pulmonary injury, as the
Okay.
patient is suffering from shortness of breath.
Okay. If a patient daughter insists you to go home, and then what do you want to do now?
Okay, first of all, I will tell her all the possible complications that might occur. Then if you decide to leave, then you have to fill a legal consent. To find that she takes responsibility of all complications that might occur. Also, I will describe the possible other symptom and signs that might develop. For example, increase in the drain, and also if he's suffering from exacerbated obstructive stress, he has to come back to the hospital or go back to the nearest hospital.
Okay, doctor. If patient daughter and patient not want to stay home, please take a legal document sign and again explain about the condition and complication, and you can give discharge against medical advice.
Okay. Thank you. Can we summarize just 3 minutes through?
Yes.
Okay.
Okay.
I summarize.
Yes.
He will.
Have patients elderly who have their weight mastectomy with very experience 2 days ago, and also she has a history of COPD with mild septic area, and also I have substitute the complication as plan of action, and also possible risk and science activity. And also I will, if she decides to leave, I will make her write a legal consent against medical advice.
Okay. What else
So I
would you
will
arrange?
start the patient against medical advice.
Yes. What else would you arrange to help the patient out?
I will arrange the social worker
Yes. Very good. Tell us why.
and yes to take yes because of the drain.
Yes. And
Then yes, and also for the shortness of breath.
okay. And to also watch out for any warning signs and symptoms, since it's a post-operation. Okay. Right. All right. Anything else? You'll also write the letter to the GP. Did you mention that in summarizing? Summary.
Mhm.
Yeah, just few seconds are left. Okay. What is the legal form that you'll give them to sign? What does it called? Yes.
Form 5.
No. But as long as you said that you'll make them sign, so it's okay. You know something at least. So yeah. So you'll send the patient with the drain and you'll arrange the social services as well. Anything else you will do to rule out why the patient is having did you say you'll do the chest X-ray and CTPA to rule out DVT and
Yes, CTVA and
okay, good. Right, and the possible complications you've already explained, and you did rule out that patient was sufficiently alert to make her own decision, right?
yes.
Good, thank you.